Elbow arthritis is the typical type of arthritis that can affect your other joints, more commonly your hips and your knees, but it can affect your elbow. Typically, it has in the past been associated with inflammatory types of issues such as rheumatoid arthritis or other type of inflammatory diseases. Due to modern medicine, medications have slowed those processes. Now, the more common type that we treat is regular osteoarthritis or wear and tear arthritis. It's usually from overuse, heavy labor, or just bad luck. The common signs with that are popping and catching, grinding in your elbow, along with pain, of course, and typically range of motion issues. Common ways to treat elbow arthritis are typically anti-inflammatories, whether they be over the counter or from prescription medications. Sometimes injections can help. The other ways to treat it are physical therapy, some creams, good stretching, and then we start moving into other more aggressive treatments such as elbow arthroscopy, where we use poke holes to clean out the elbow and hopefully decrease the pain and increase range of motion, providing relief. Other ways to treat it are more advanced with elbow replacements, whether it be partial or complete, or other type of advanced surgical procedures.